I caught a line in while I was waiting for this session in the speakers lounge, and I think that sort of helps in saying why, why we are doing what we are doing. And it was more about, Devang said that, the one thing about human beings is that there is a gunjaish of actually changing yourself. And I think, in many ways, if you can know yourself and who you are, I think there's a possibility also that you can change. And how that translates into what we do in genomics and others is that when you think about who you are today, right? You look like your parents, you look like your grandparents, maybe you even eat like them, maybe you even emulate a lot of the things that they do. A lot of things that you're doing is what is coming from your environment and so on. So when you think about it, what is it that we are doing? And why is it that understanding your own genetic self is important, right? So I'll just give a brief background. I started my journey 24 years ago. And around the time that the Human Genome Project got completed, I decided that this was an area which was very interesting, and I jumped into it without having much knowledge, even though I came from IIT and I studied physics over there. So I think over the last 24 years, I founded 2 companies. I started more with working with pharma and biotech, and then eventually went on to doing things where we were the first consumer genomics company, and we started moving in that space. And eventually, I think today we are doing more about health span and longevity, because people understand that if they can find ways to fine-tune their own behavior and lifestyle, they are able to actually make those changes and see that in their health. And today, I think the great news is that there is a lot of information that we have that we can actually record and study. So for instance, I think many of you probably use watches or rings or monitors to measure your blood sugar levels, blood pressure levels, and so on. But the basics, where you want to understand who you are, I think starts from very simple things, which is your DNA, right? And from that DNA comes things that change your DNA, which basically says that all of us are 99.9% alike, you and me are alike. But if we want to find out what makes me me and what makes you, the 0.1% is what will make the difference between you and me. But what happens, we all grow up in our 20s, we are fine, we eat, we drink, we do all kinds of things, everything looks great. But after a few years, things start to crumble. What happens? So I think that's where you see that now there are 12 places where you can see what causes aging. And some of the most simpler ways to be able to measure and actually alter that is by 3 means, right? One is to say, can I understand what predisposes me to a particular disease or to a particular, nutrition? How do I metabolize something? Can I find out, anything about my behavior and things like that? The second aspect is also about understanding your gut microbiome. And the third is to say, all the lifestyle that you have done, has that made a difference? So I think one thing I wanted to point out was that a lot of people say, ye to meri family mein it runs, I can't do anything about it, right? It will eventually happen. But the truth is, 80% of cardiovascular diseases are preventable, 60% of diabetes is preventable, and 50% of cancers are preventable, which basically means that when you understand and you know who you are and what creates and what causes that behavior in you, if you can change that, there is a huge possibility of being able to control the whole epidemic of chronic diseases in our country. So these are the 3 elements, right? The part that you can change is the ability to be able to change your environment and your lifestyle. What you are born with remains. So many people, like I said, is DNA your destiny? It is not, because you might be born with something, but you have the ability to change, because a large portion of what happens to you is determined by your actions and your decisions. So these are one interesting thing. We did a longevity study in India, and it was interesting. We looked at people who were over 90, And we found some very interesting genes that were there, which were associated with cardiovascular and neurological conditions. But habits make a huge difference, and gender makes a difference. So it was found that women live longer, and short women and stubborn women live longer, which was a very interesting thing that we found, right? So for a lot of people to say, fine, you know, you're giving me all this knowledge, give me a solution. So I think that's where you can start with, which are 3 or 4 things that you can today do with great amount of certainty. The first is a simpler one, to say, what genes did your parents give to you, right? What did you inherit from them? And I think that's the basis. It starts when you are a baby until you are an adult. I think that continues. The second part is the microbiome. I think a lot of times we talk about our gut feeling. I think your gut really has a feeling. And yesterday I was in some session in Singapore, and it was interesting. I found out that in the Chinese medicine, your tongue is also a great way of looking at it. You can also do a microbiome testing of your tongue as well, and of your saliva. And that last part, which is still a fairly new thing, is to be able to understand with a fair amount of precision that you have today. You might be, let's say, 50 years old, but biologically you might be 45 or you might be 55. And you can also understand whether your brain is aging faster than your lung, your heart is aging faster or not. So you can actually look at all of this with different ages for different parts of your body. So if you're not looking at a lot of this information today, I think there are things that you can do today to be able to change. And I'm looking forward to a discussion, so I think I'll leave you with this thought. Inherited genes don't change. Microbiome doesn't lie. So even though you're saying you're eating right, your microbiome might tell you that you were actually eating sweets and carbohydrates. And the third is that epigenome carries your truth. So thank you.
That's really, really very interesting. Which part of the body gets aged faster? Very interesting. And to more about it, I request Radhika Bajaj to join us on stage to chair this session. And yeah. In fact, Anu has got a lot of plans. She aims to make preventive healthcare accessible and affordable for people through genomics. She has received many awards and honors for her entrepreneur and social impact. Over to you, Radhika.
Thank you very much, Bhargavi. Anu, welcome. I think the information you gave us right now was educational. It was fascinating. I think the first thing I want to understand is, are you still making people aware? Because I'm quite sure that many of us sitting here did not know that you could get tested this way. And these are the different kind of genome-based tests that can actually happen in India now.
So what I've found is that, should I use this?
I think your mic's fine.
Mic's fine, okay. So what I've found is that there is a gradient of people who sort of on the awareness level. So 10 years ago, it was like pretty much almost no one knew, right? 10, 11 years ago, except for the few people who had probably gone outside India and tested themselves. Today, I think there are some people who are extremely well aware, right? So there are these people who fully understand epigenetics, they understand microbiome and all of that. But there is a large section of the population that still needs that education today. They're not yet aware. And I think it becomes harder and harder, especially for those where we are not speaking in English or in Hindi, I think, and that's a very large part of India, right? So there is still a big portion that I feel we still need to do awareness in terms of how do you actually prevent and know yourself.
Absolutely, and I'm interested in knowing that since you started till now, who is buying your test? And what is the intention of people who are actually going for these tests?
So there are different types of people, right? There are some people who say, okay, I want to find out where I came from, right? I want to know if I have a little bit of French DNA or you know, some other country, or am I 100% from Telangana? Do I have some DNA from? So that is one set of people. These are people who just want to know where they came from. The second set of people, and I think that we see a large number of them, is people who want to make changes to their diet, They find that their food doesn't work the way they want it to work. They feel bloating or they want to lose weight or otherwise. So that's a large number of people who do the test. Then there is people who know that there is a disease in their family that is genetic, runs in their families, like diabetes and cardiovascular diseases, or even cancer for that matter. So we are able to then find all of that. And now I think we get pretty much samples from across the country and also abroad, because it's a saliva test. So you just place an order online and the kit comes to your house. So you don't have we are not restricted by geography. I think we are restricted today more by awareness than by geography.
How much does it cost?
It doesn't cost much. It's I think the tests are starting from 5,000 to 8,000 on an average for the preventive tests. There are also tests that are more expensive, like the aging one is still very expensive. The microbiome tests are typically you would find between 10 and 15,000. The epigenetic tests are currently still 40 and above. So that's the one which is still, because the awareness is at a very small level, the cost of the reagents is still very high. But I think a large part where you can actually do a full understanding of your genome and take necessary steps, I think those are very, very, I mean, for a lifetime you get information for less than 7,
yeah,
7,
but
8
is there also a sort of trust deficit in tests like this? Because, and I'll tell you why I asked this, because in India, I think many people would say that genome testing is still in its nascent stages. You are there are a few other players there, but like you said, awareness is limited. So where is the data coming from on the basis of which you're giving us results? Because I would imagine that in the West, since it's more advanced in this particular field, the data bank would be Caucasian. So
that was true 12 years ago.
Okay.
Right? It is not true now. I think today we have enough data on our own. We have enough data that's coming from Indian scientists. There's enough data that is there in like the UK Biobank and others. So for instance, one of the recent things that we did was to be able to connect the dots from your genetic information, your blood information and others. We are more advanced than many other nations. But somehow in India we tend to, ghar ki murgi dal barabar, right? That's the truth. But I don't think today there is a difference really. But 12 years ago, I agree. That was part of the reason I wanted to start this, right? That we didn't have enough data points. It was primarily Caucasian, and there were lots of things that were changing in the Indian population. Today, I think we have understood the frequency of that. One area which I forgot to mention, which is very popular with the doctors, is where you can actually understand which medicine will work, right? And I think for that, today there is very clear guidelines for that. So there, if you look at the FDA website or you look at CPIC or other such organizations, I think they're very clear understanding of saying, is this medicine going to work in the standard dosage? Do you need to actually change the dosage? And is it going to not work for you based on your metabolism of that particular medicine? So I think today there is a lot more, I don't see the trust part. I think there are a couple of people who are probably worried about, one, if the knowledge will make them anxious, right? Now that's, there's been enough studies now done that that is not true. The other set of doubts that people have could also be where they say, okay, what happens to the data?
I was about to get to that. Yeah. So what happens to the data? I mean, who else knows?
So nobody else knows. I think it depends on whether you want to share it with someone, right? So you have to, there are guidelines that you keep the data, like your personal data, separated from the actual genetic data. Now, if you want to share it with your doctor, that's something that you are doing, right? But it doesn't get shared with your employer, it doesn't get shared with your insurance, it doesn't get shared with anyone, except if you consent to do so, right? So that is ultimately dependent on the consumer. If they give consent for the data to be used, it will be in an anonymized form. So it never will be saying that, we will never have data that would say, Radhika has this gene and therefore you should...
Yet to get tested, but I think she's here to convince us. So. Anu, we spoke about data privacy, we spoke about what kind of data banks exists. Can you think of examples where people have actually found a real solution to whatever medical issues they were facing because of a test they took with you?
Absolutely. I think there have been many examples. I think one, we had a very top level athlete, I'm not able to say the name, but we were able to find out or fine tune their nutrition and others based on their genes. Did go on to win a lot of laurels for the country. So that was one easy thing to understand. In many cases, we've been able to find out and make people change their medication, right? So my own mom was an example where she got diabetes fairly late, but when she did, the doctor had prescribed her some medicine, which she suddenly started feeling like not as energetic, and she was a little bit down. And when she came to visit me, I said, "What happened? You don't seem like your normal self." And then I said, "Did you change anything?" And one of the things she had changed was her medicine. So I looked at her medicine, I looked at her reports, and I said, "Let's go and visit a doctor here, in Hyderabad." We went and visited, and I showed him the report. She changed the medicine, and I think from then she's been fine. So I think there are many such cases. I mean, this is something that was close to my heart. There have been cases where people who looking at specific medication for cancer, I think that you find that has been a very clear understanding of saying which will work for this patient. And I think today a lot of the doctors are recommending those tests. And I think for a lot of people, my own case, I think it shows a lot of things that were there which are confirmed by blood test. But I think I also use that information, and I think I know I'm an extreme data hog, but I think it has been very helpful for me to be able to say that I have a predisposition for something, and how do I actually, I have twice the risk of an average person to get diabetes, but I don't, right? So I think it's a matter of knowledge, and it's a matter of how do you actually use that.
Do you feel that, in recent years, I think especially after COVID, we've seen a rise in how aware people want to be about their bodies, how they are focusing on health and fitness. Has that sort of helped your business grow?
Absolutely. I think it also helped that people knew what DNA was, what RNA was. I think every day on TV, you heard DNA and you heard saliva, like you heard about a swab. So suddenly after COVID, you didn't have to explain to people what is a swab, right? Because the only thing you have to tell is you're not going to shove it down your nose or your throat. We're going to just get it gently from your cheeks. So it definitely helped in just this basic logistics. But the second thing is that people started hearing all these stories about young people dying of a heart attack and others.
A lot of anecdotal incidents like that, yes.
Many. There have been a lot of rise, and I think people also realize that there are solutions to that. I think it's not enough to know that this happens, but I think what is interesting for people is to say, if we know, can we prevent? And I think COVID really helped because it helps in introspecting and finding out who you are, and therefore we saw that huge change in behavior.
Let's focus a little bit on you as an entrepreneur. I think the fact that you entered genome testing in India at a time when there was even little, awareness around it, you've kind of gone in category creation, right? Which is challenging for any entrepreneur, but in an industry like this, perhaps even more challenging. So tell me why you took the decision to go this way, go this route.
I think, taking risk is in my genes. and I constantly was telling someone about how I write in the night, to understand who I am, right? And if you go through your journey from when you are a child, you can start seeing those behavior. If you write it down, you map it, you will be able to see, what kind of a person you are. And I think that's what I realized, right? Like I enjoy doing new things. And I think that love for this curiosity, I think all of that came from my dad and I'm sure, and my mom as well. My dad was a scientist, so I think constantly did new things, and that joy of creating something, the joy of finding something new was always exciting for me. So I think when we started in 2000, I really didn't know much. I came from IIT Kharagpur. We had worked for a startup, and when we heard that this bioinformatics, and Google wasn't even there, I found that fascinating. The fact that you can decode your software, your own software, I think for me was that challenge is very exciting. So I think if I did something more standard, I would get bored. But there are many others who probably that doesn't work for them. So it depends. I enjoy roller coasters. Not everybody does, right? So
I'm very interested in knowing what your pitch meetings with investors were in the earliest days.
That used to be very funny because I had to keep explaining that what is DNA and RNA, and every time, and I remember IFC, the World Bank also came on as an investor. So the initial interest was very high because we were one of the earliest, but it was very funny because people kept changing. And every time you had to start with what is DNA, what is RNA. And then I started explaining it in very simple terms. I said, think about it as a toothbrush. Right, and then you have these, these bristles that are like your, the markers that are there, and then what you get from it. So you had to really start breaking it down. And I think many of those investor meetings, because it was difficult for them to understand, you start breaking it down. And I think in the end, I think that really helps you because ultimately communicating to the average consumer also requires you to break down a complex subject into simple things. So I think, those initial meetings were interesting. Everybody loves it that we are doing something, but I think it's hard for them to understand. And so you bring it down to the level that maybe hopefully they can understand.
Yeah, so, I do want to read out this one stat that I picked up about Mapmygenome, which was that I think around 2015, you raised $1.1 million. And that was one of the seed funding rounds. And there are 26 investors now.
No, there are only 13 investors.
Only 13. Yeah. Okay. And how is the company valued now? Would you like to share that?
No, I mean, we mostly self-funded it. After that, we had Mr. Tata as an investor. That was a great meeting and a great investor to get. But now we are hoping that we'll take it to the next level. So we went through this interesting time during COVID as well. I think in Hyderabad especially, because we were also in the airport and we did COVID testing, more people thought we were a COVID testing company than a genome company. But I think, today I think it's a very different thing, and hopefully we'll take it to the next level in this coming year.
Okay, so there is always that question mark when it comes to investors reacting to female founders. Did you face that as well, and especially given that people didn't have a lot of understanding about genomics in India?
No, I don't think necessarily that they had a problem with me being a female founder. I think it was more about them not understanding the category, right? It was more about a newer area. I don't think that people think that I don't understand the subject. At least maybe in the beginning they might have thought, but now I don't see that problem.
Yeah.
But certainly I think it is more about, and we've stayed on course for 24 years, so it's not like we haven't been there. But there is probably more than being a female founder. I think we'll start seeing ageism more than the...
Ageism?
Yes.
There's one more thing we have to tackle.
Yes, of course.
Okay.
That's why I don't want to become old. So you want to stay healthy because you continue staying young.
Sure.
I'm constantly still a startup founder, right?
Yeah. So, I also want to understand if cheaper tests are in the works because, even if you say roughly a test starts at 6,000 or 5,000 rupees, it's still expensive, and that's the most basic one.
It's not that basic. It still covers more than 100 and something conditions. So if you break it down...
But if I want to do that longevity test that you're taking, how much would that cost me?
So your longevity is multiple things, right? So you start with the basic test, like a genome patri, which is our more popular product. That is retails today at 8,000 with, and a lot of Diwali and other offers are there. So they're not that expensive, right? And you look at it as something that is coming for once in a lifetime. You're looking at 100 conditions. It's a fairly comprehensive product. If you're looking at the epigenetics product, that is definitely expensive. And I think it's expensive because there are very few people buying it. And today we are working with a partner in the US because there are not enough such tests that people do in India. But once we start doing it here, we'll start seeing that come down, right? But it'll not be hugely down because the people who manufacture these reagents, I think, it still needs enough awareness. Once it does, the cost of the test, like the chip itself, is not that much for them. For us, it still is. So India, I think the problem is nobody manufactures these in India. We are still importing a lot of the reagents. And today, I think we end up paying more customs and GST and everything else, more customs and all for importing any of these, right? So you pay 30% more than your average person who sits in the US or otherwise. And the Indian customer pays less than half of what anyone pays outside of India. In Canada, the same tests, I think we're at $800 when we are pricing it at $90, right? So I think there is a huge mismatch today.
But is there also an opportunity, for example, for India? So talk to us about that. I mean, globally.
I think there is I keep telling people that, in India, we wait till you fall sick, like seriously sick, and then people spend lakhs, if not crores of rupees in hospital bills. And once someone has a stroke or otherwise, you see that, I'm sure it's there in every family in India, that there is somebody who's had, that sort of, and they end up spending so much money and they don't get back in return. But if they did this intervention upfront, you're more likely to be able to save that, right? So you have to calculate the cost of what is the opportunity cost for you really, right? Because if you're going to spend, lakhs and crores versus spending 5,000-6,000, I think there is a,
So clearly a huge scope in terms of preventive testing. But I think my final question to you would be that, do you think innovation in genetics can actually help healthcare policies in India?
I think it can. If today, let's say, if we spend today in, let's say, wanting to do a genetic test for everybody in the country, right? I think that information will be so valuable. Iceland did that. There are a few, Abu Dhabi is doing it. The value that you will get from there in terms of how do you design your nutrition policy, how do you design a lot of your systems, and how do you train these doctors or nurses or otherwise, even in the smaller communities and states, I think that can have immense value. But we are not doing that. But we'll still spend on many other things that come much later in their life. So I think, today we are seeing that insurance companies want consumers to do it because they find there is behavior change. And behavior change means lower claims.
Correct.
Means ultimately, you win, the insurance company wins. Same thing, I think, when you look at it from for a doctor, it still might not be as useful.
Right.
But I think that requires, we are seeing changes that are happening for corporates, for insurance, and for others as well.
I think in so many aspects, like we say, prevention is better than cure, right?
We say actually prevention is not just better than cure, prevention is the cure.
Prevention is the cure, right? On that note, thank you so much for joining us here today on The Southern Rising. Thank you.
Thank you, Anu Acharya. Thank you very much. I request Preeta Dandapani, Assistant Vice President, Ad Sales, ABP Network, to kindly come up and do the felicitation. Thank you, Radhika. Thank you very much once again. We're also streaming live on abp_live.com. Kindly let your loved ones know that, and you can watch us live. We are streaming. Well, ladies and gentlemen, the Southern Rising Summit 2024